All right, thanks, Kristen. And the demand for coronavirus testing leading up to Thanksgiving spiked as some people decided to go ahead and host their family gatherings or travel despite the CDC's call not to do it. NBC Connecticut's Dominique Moody has a look at why getting a test too soon can present some challenges.
Maybe having a false sense of security that I was negative, but 3 days later on, I might turn positive.
Those are the reasons why Dr. Ajay Kumar of Hartford Healthcare is urging the public to pay attention to when they believe they were potentially exposed to COVID-19.
The incubation is 14 days, so we can see the increased amount of infections happening, positive infection test results coming back in 5th, 7th day of exposure.
Dr. Kumar says getting a test 5 to 7 days after potential exposure is a great timeline to adhere to. That is, unless you start to present symptoms.
The possibility of turning positive if you're truly infected is higher.
Medical leaders say getting a COVID-19 test is key to mitigating the spread of the virus, and they're also urging the public to continue adhering to the state's guidelines through the next couple of months. If you traveled or gathered with family or close friends during the holidays, health experts recommend quarantining for at least 14 days as a precaution.
I think in some ways we have to double down to get through the next 2 or 3 months when we anticipate we're going to see rises in cases.
Dr. David Bannock is an epidemiologist at UConn Health and says even with the news of potential COVID-19 vaccines, the public has to maintain key safety measures.
It's out there, it's coming, it's going to be here. And I think, doing what we can to keep things as controlled and mitigated as possible is going to be really just critical.
In Farmington, Dominique Moody, NBC Connecticut News.